Welcome to our presentation on Holism and Osteopathy, bridging the gap between concept and practice, a grounded theory study. Whilst the concept of holism is present in the literature and in the minds of practitioners in many health fields, the practical implementation of holism and what this means at the level of practice needed further research, with some sources in the literature suggesting that the implementation of holism in a deep integrated way is difficult due to the biomedical framework of practice. This study therefore had two main aims: to interview experienced osteopathic practitioners about the individual concept of holism and how they practically implement this, and to explore what holism and biomedical approaches meant to participants and how they each contributed to their education and practice, therefore contributing to a theory which can help bridge the gap between holistic concept, including its relationship with biomedicine, and its practical implementation. The core theme emerging was awareness of relationships, and there are two important relationships to consider: the relationship between the tissues or pathology causing the symptoms and the symptoms themselves, which is associated often with a biomedical approach, and the relationship between what else is going on in a person's life, physically, mentally, emotionally, spiritually, socially, environmentally, in the present and the past, and the tissues causing the symptoms. And this is the approach taken with the holistic view. The what else was limited in exploration during assessment and treatment, depending on an individual's past background education and the concept of holism. And understanding these relationships shows how they overlap and which each primarily emphasises. All participants saw the biomedical as a part of a holistic approach, and them being inclusive rather than separate entities. This is a picture illustrating the previous slide. When questioned, participants identified primary areas manifesting the relationship imbalances between all contributing components with ART, asymmetry, range of motion abnormality, which is specifically related to quality of movement dysfunction, and tissue texture changes, or the feeling in the tissues. Participants identified three main factors that influence their treatment. The first is patient expectations, or patient wants, which often relates to symptoms and tissues causing symptoms, but may relate to deeper causes or what else is happening in the whole person contributing. The second is what the tissues reveal, tissue needs, which requires a holistic assessment to determine. And the third is background education and knowledge. 5 participants say they always treat the symptomatic area, if for nothing more than to satisfy patient expectations. 3 rarely treat symptoms, suggesting they're really the primary dysfunction needing treatment. However, all participants include other areas or what else into their treatment, or they wouldn't get good results. The biomedical education helps in a couple of ways. First, it provides the basic building blocks of understanding the human body: anatomy, physiology, pathology, conditions, signs and symptoms, history, regional and medical investigation and management, and so forth. But this doesn't tell the practitioner what is actually needed, but only possible needs. Therefore, a practitioner should not limit his assessment to only the history information and textbook information on their own, or they may miss the what else. What else requires a holistic or general assessment, because we don't know what is actually there until we assess for it in the first place. If nothing else is there, knowing everything else is okay, we can treat the symptomatic area and that is it. However, once we find what's happening from a holistic assessment, and we know what else is present, this together with other information from our holistic assessment, the history and our biomedical education, can render that all more meaningful by explaining the relationships between what else is happening and the tissues causing symptoms, after we've found the problem first. In this way, it links actual findings with background education and patient expectations. But in order to assess holistically, it helps to have a holistic education. Participants indicated that their biomedical education was emphasised and developed to a high level of understanding, but the holistic integrative elements were not emphasised or followed through. As a consequence, they initially started practicing from a more biomedical framework, and finding that the symptomatic approach wasn't working, had to reacquire the holistic elements over many years. In terms of bridging the gap between concept and practice, the diagnostic triad of ART was found to be a linking element. This identifies primary areas in the body, or what else is present, manifesting relationship imbalances between involved components of the whole person. Treatment involves being mindful of these relationships between what else and the tissues causing symptoms whilst treatment is being implemented. The restoration of balanced function is a clue that one's treatment is successful. This study may provide a theoretical framework for evaluating education and exploring future research involving patients with chronic health issues. We could say that the tissues causing symptoms may be similar in many cases, but the relationship between what else and the tissues causing symptoms may vary considerably, thus contributing to the individuality of each patient's presentation.